Now I'm getting serious. Okay, how many of you out there have experienced back pain before? Probably most of us, right? Okay. If you're over 25 years old, high probability that you have something going on in your spine. More specifically, one of the big reasons for low back pain is malalignment of the spine, okay? Especially in women, they get scoliosis. How many of you guys heard that before? Okay, after the hip flexors, we're looking at the hamstrings. They actually go from where you sit all the way down to the back of your leg. Most of us out there have tight hamstrings. What that does is it actually pulls and creates a lot of stress on the pelvis, which in turn affects the lower back. Do you guys see a common denominator here? Absolutely. Next, we're looking at, after a lack of flexibility, after of malalignment in the spine, we're looking at weak muscles, which occur because of those two factors. So now we're progressing from one to the next. You have weak muscles, what happens to them? They're not long and lean like a ballerina. They're short and tight. As they're short and tight, they can't generate enough force. Guess what? We start compensating. That's another reason, another mechanism of why we have low back pain. And all this together creates everything we see out there, right? You guys suffer from herniated disc. Guess what? That could happen because of the malalignment of the spine. Your posturing. How many of you guys have a job where you're sitting at a computer all day, right? This is the posture you guys have, all right? Rounded shoulders, leaning forward, head forward. All this contributes to low back pain. How many of you out there also have gone through pregnancy? Again, very weak in the areas that I had just discussed. The erector spinae back here, which are important for your posture, your hip muscles, everything in your lower legs. So you're weak and short. Again, these are things that are going to contribute to a lot of low back pain. How many out there actually have been diagnosed with scoliosis? Okay, that's an S-curve in your spine. Guess what? It occurs very frequently in women. Probably a 3-to-1 ratio than men. So what I'm saying is, I'm here today to make it clear that low back pain is a very complex topic. And I'm here to differentiate what is out there as far as diagnoses and how to get you better quickly, naturally, without drugs and without surgery. So this is our first part of this series, and I'm going to be coming back in a little bit to do part 2. Take care, everyone. Hey guys, I'm back for part 2. Are you ready? Okay, here we go. Obviously, there's many types of diagnoses out there for low back pain. I broke it down into the 3 most common so we can get a good understanding of what they are. We already talked about in part 1 how they occur. Now we're going to talk about specifically what they are and then how to treat them. Now again, as we talked about, you have choices out there. Okay? Most doctors are going to pump you up with corticosteroids or cortisone, pain medications, and they're going to suggest surgery. Here's a wake-up call, folks. Do you know that 50% of the surgeries that are performed in the United States are only 50% effective? Did you really know that? You're not guaranteed. Do you know how long the length of time is to get back to normal? Are you kidding me? Why not do it the holistic way? And that's what we're here for. The most effective way that's going to get you back quick, and we're going to decrease the amount of reoccurrence. When you have surgery, guess what? Do you know how many people out there, studies have shown, that after getting their first surgery, guess what? They get a second back surgery within 5 years. I don't know about you, but that's not what I want. And as the expert that I am, 25 years doing this, 15,000 patients, I think that qualifies me as an expert. So let's break this down. First, we got a muscle strain or sprain. Okay, how many of you guys, like we were saying, you're lifting an object. So basically, the muscles we're talking about from the back of your head, up part of your neck, all the way down, basically to where, when you put your hands on your hips, those are the muscles that we're talking about that get affected. Okay, sometimes they even go into spasm. which is, you know what that is? That's locking. Have you guys ever experienced this after lifting something heavy? I'm sure you have. That's what we're talking about. So, what I'm going to show you is a few exercises. We're going to talk about them first. In part 3, we're going to demonstrate how to do them. Okay, first thing we're looking at, stretching the hips. Okay, again, we were talking about the imbalances. This is what's contributing to the problem. And this is what we have to take care of. Muscle imbalance and malalignment of the spine. So we're going to stretch the hips, the hamstrings, the calves, and again, from the neck to the lower back. We're going to focus on that. We need things to be long and loose so that, guess what? We can come back with a comprehensive strengthening program that's customized to the diagnosis, not some knucklehead giving you a sheet saying, hey, here, go do these exercises. You're going to call me first when you got pain in your back. That's number 1. And number 2, I'm going to design the program and you're going to come work out with us. Okay, second condition, arthritis and spinal stenosis. Let's just make this very simple. Arthritis, anything that has an itis at the end of it, that's an inflammation. Do you guys think it's good or do you think it's bad? Obviously it's bad. Stenosis is narrowing of the spinal canal, which can occur for several reasons, but the top reasons are calcium deposits and the bones in your back, and this can occur on any part of the bones in your back, especially the ones that hold your spine together. Okay, so for stenosis, what happens is that as you are walking, because there's not much room in there, you're putting compression on the nerves. When you put compression on the nerves, you're basically cutting off the signal and your legs just give way. Okay, what I'm here to do is to show you that we need to work on the front part of the body, which are the abdominals, which actually start up here by your ribs and go all the way down to your lower hips. That's one part. And we're also going to work on your lower back. Again, like we said, from your neck to your lower back, we need to strengthen those exercises, those muscles, I'm sorry. And then next, because of the stenosis, when we're standing, this position aggravates it, so we want to do a flex position. So we're going to do some exercises where we're flexing to decrease that compression on that spinal canal. And last but not least, herniated disc. And just to let you know, guys, as you can see through the chart here, this is the progression that will probably happen if you don't address it in the least painful stage or the least involved stage. And when you get to here, surgery is the first option that the doctor's going to tell you. Why does a herniated disc occur? This again has to do with alignment and the space that's usually in between the bones in your back and the jelly part, okay? When that's off and it's tilted to the side or twisted, that's when that jelly comes out of the side. And that's where you get, again, compression on the nerve. Have you guys ever had pain shoot down the back of your leg or the front of your leg? High probability that's a herniated disc. So anything where you're sitting a lot or you're flexed in this position is going to make you worse. So the first thing we're going to do is we're going to go and work on these muscles called the prone push-up, and we're going to demonstrate these in part 3. And any type of standing exercise, extension exercise, which is going to relieve the stress off of that jelly-like substance in your lower back. So I broke this down into 3 simple areas, but honestly, folks, this is a progression you don't want. Actually, if you started here, you'd want to go back the other way, and that's what we're going to help you do. So part 3, we're going to show you the specific exercise you need to get better quickly and effectively for each condition. And this will be part of your strength and conditioning program, which, you know what, I don't care if you're an athlete or if you're not an athlete, this is what you need to prevent the probability of reoccurrence.